When patients come into the office and they describe for me this dislike of themselves, and they specify that it has to do with physical features of their body or their voice, we diagnose them with gender dysphoria. And gender dysphoria starts to eat away at them and make it very uncomfortable for them to live. And they feel like they have to hide these feelings, and it makes them very depressed and often anxious that they are hiding who they really feel like they are. And gender-affirming care is when we help them start living in their body as they feel like they want to be. So if they feel like they are more masculine, they would want to appear more masculine. And if they feel like they're more feminine, they would like to appear more feminine. Until they start taking steps to transition over to the gender that they feel matches their identity better, they feel a lot of distress and unhappiness. And most of these people have struggled with depression and suicidal feelings for years before they decide to transition or get medical help. Oftentimes they have carefully thought of this process for years. They've researched like how long it will take them to transition. They've talked to other people on the internet a lot of times about like what are the effects. They've followed other people's stories, and they come in when they're ready to transition, and they're over the moon excited to start this new journey. And often they have support of their family. Sometimes they have support of friends. Some people lose everybody when they decide to transition for various reasons, but they take this courageous step because they can't hide anymore how they truly feel. Not everyone needs the same exact like roadmap for transitioning. Some people never need to take hormones, but a lot of people do want to take hormones. Some people never need any surgery at all, and other people want a lot of surgery. And everybody's different. That's the number one rule. Nobody's transition's the same. Oftentimes we'll see them start to have less depression when they like start their transition, or less anxiety. And it's just an exciting process, and these are some of the happiest patients I've ever cared for. So it's very rewarding for a gender-affirming care specialist. Well, the ban means that they're not going to be able to keep getting their hormone treatments that we already decided that as a team that they need. And so I feel like they'll still need to get their hormones. They will probably go out of state, so they'll be suddenly burdened with a new cost to the treatment. I don't think anybody will stop their treatment. I don't think the ban's going to actually suddenly make people stop transitioning. I do think that this will cause more depression, more suicidal thoughts for people who maybe haven't started hormones yet. I feel like there might be fear in bringing it up to their doctors. They may not know where to go get care because everyone's going to be afraid to talk about treating you. But by and large, I think the biggest thing will be cost. I think the people who can afford to fly out of state and go see doctors in another state, get their blood checked in another state, I think they'll have the best chance of having a seamless transition. But I think people who are on the lower income scale are going to be really burdened and maybe not even be able to afford that kind of treatment. And it makes me very sad for these patients. So it's really an assault on this whole population. You know, a lot of adult transgender people are already having difficulty with housing and jobs, and they do live in fear of being outed. You know, for the state of Idaho to now enact legislature that Brad Little signed to keep Idaho Medicaid from paying for any medical care related to being gender-affirming care, it's again kind of hate legislation. Like, this group of people do not cost the state of Idaho hardly any money at all. The drugs are not expensive. There's not that many office visits per year, and for them to just target this as a way to save money, it's just mean, deep down mean therapy to do this to our patients.